There are groups of people around the world that outperform on every health measure. In what researchers have identified as blue zones, people have a low incidence of chronic disease. So what's their secret? Well, it's not genetics, and it's not entirely their diet. It's actually something much simpler. It's scalable, it's free, and it's unfortunately missing from the American healthcare system. It's the power of social ties. Research on these populations show that a trusted community is critical to propagating healthy behaviors. And we're building an application that allows physicians to leverage this. So let's meet a typical chronic disease patient. Mary is 42, and recently she was diagnosed with type 2 diabetes. So naturally, like all of us, the first thing she does is go to Google, and she's overwhelmed. There's medication, insulin injections. For days, her targeted Gmail ads are about foot amputations. She feels scared, and she feels lonely. And that is because Mary is one of several thousand patients that her physician sees annually. Her doctor doesn't have the time to provide support and education in a short 15-minute visit that happens once or twice a year. So what if, instead, her physician could group her with like-minded patients? What if they could learn and get support together in a blue zone facilitated by her hospital? Let me show you how Health Crew enables this. Along with her meds, Mary's physician prescribes her Health Crew. Because the invite comes directly from her physician, she can trust the content. On the other hand, Health Crew has access to her medical history. So when she goes to the Learn tab, she sees content that has been personalized for her. For example, Mary has both diabetes and high blood pressure, so she reads a document about interpreting her values given both conditions. But not every question Mary has can be answered here, so she goes to the Discuss tab to learn more from her peers. She sees that a peer has brought up a fad diet, and she's pretty skeptical about the scientific backing, so she clicks the fact check button. And this notifies a nurse on her physician's team to weigh in on the discussion. As Mary browses through the site, she sees that there's this one other peer who's asking a lot of the same questions that she has, and she wants to learn more. So she goes to the Group tab. And here's what makes Health Crew so compelling to patients. The patients have been grouped into a small community of people who have the same health issues, and they share the same doctor. It's trusted, it's intimate, it's far more trustworthy than those anonymous patient forums she found through Google. So Mary finds a few people she relates to, and they go together on a morning walk. So now she's getting in-person peer-to-peer support, which is a proven model for behavior change. Mary is effectively part of a new blue zone, and this is a blue zone that's facilitated by her doctor and her physician. Now, my co-founder Sohan is going to explain to you why hospitals and doctors want to be part of these blue zones.
Thanks, Bunsey. So for a long time, hospitals were not actually on the hook for the health outcomes of their patients. Instead, they got paid for every lab, test, and procedure that they ran. But today, as a result of the Affordable Care Act, hospitals will actually lose money if they don't ensure that their patients are properly managing their chronic condition. And for proper management of a chronic condition, you have to be able to commit to behavior change. This is why hospitals and clinics will be really interested in a tool like Health Crew. And for physicians, our tool actually helps them deliver better care without adding to their workday. As a medical student at Stanford, I saw firsthand how jam-packed the days got and how repetitive certain tasks were. Health Crew is going to be the more sensible way to manage these patients. First, it allows them to answer common questions in an efficient manner. Second, it allows them to lean on superstar patients to amplify their message. And lastly, the whole approach has been validated by medical studies. Even with this clear value proposition, we know it's difficult to sell and deploy software to hospitals and clinics. So we're using a hybrid strategy. Our bottom-up approach is to make it free for individual doctors to drive adoption. And our top-down strategy involves sales to top clinics and hospitals, especially those affected by the Affordable Care Act. We're in private beta at 3 sites, including Stanford, and we've been really impressed with the initial results. And we're ready to bring Health Crew to the rest of the country. The reason you see me here today and not in a hospital taking care of patients is because the day-to-day life of a physician has become very transactional. It's all about diagnosing and prescribing. And in reality, most doctors want to be educators and mentors for their patients. So technology should exist to further that, not complicate it. And we think the best way to do this is by creating more blue zones, or these communities of patients, using our platform. So if you're a physician interested in bringing health crew to your clinic, please go to our website to sign up. And if you're a patient interested, please talk to your doctor to see if health crew is right for you. Thank you so much.
All right. Great job. Judges.
How do you measure outcomes in these groups?
So we're starting off with diabetes, and there's a very specific marker in diabetes called hemoglobin A1C. So we'll be tracking that during our pilots. And the studies that we've based our model on have shown already that it does change outcomes.
Is it, this is so interesting that it doesn't exist right now, which I don't know. So tell me if A, there's anything like it, because it seems, you know, like an amazing undertaking. Do you extend to offline groups as well as online? It seems like in your demo it was very, based on research and like information, which is a huge problem on the web. So I understand that problem to solve. Does it extend to offline? So
Absolutely.
First competitors, and then how does it work offline?
Yeah.
Good.
So to answer your first question about timing and if this is done before, there are these anonymous patient forums on one hand, and on the other hand, you can get concierge-style, on-demand apps to help you manage your care. The first is pretty lonely, and there's a lot of false information, and the second actually only reaches people who can afford it, whereas we are kind of bringing this to the vast majority of people who get very low-quality primary care. And then the second component is, as a result of the ACA, financial incentives have changed for more hospitals. So actually right now is the perfect time to be integrating this into delivery experience in hospitals.
And then your second question, in-person is huge. In fact, most of the studies are based on in-person models and peer mentoring, et cetera. So we want to use this as a platform for encouraging that. And there's sort of two flavors there. It could be sort of patients coordinating that on their own, as well as the physician's office saying, hey, let's do a meetup for all the patients.
I think you're trying to solve a very important problem, and I think that your product looks great. My question is about penetrating the hospitals. It seems to me like it's way more than just enterprise